Hello and welcome to Sex Ed Sundays with Dr. Sonya Maya. I'm here to talk about sexual health, relationships, and psychology. Please make sure to like and subscribe if you enjoy this content. And yeah, let's get into the video. I want to talk about delayed ejaculation. So from my research, I have seen a lot of different sources claim that delayed ejaculation is pretty rare and pretty misunderstood. But from what I've seen in terms of my comments on TikTok and overall research, as well as my studies at the Sexual Health Alliance, where I'm getting my sex therapy certification, it turns out that delayed ejaculation seems to be a pretty common issue. So I was looking at this 2022 peer review, and it used this one source from 1999 and another source from 2001 to state that the prevalence of delayed ejaculation is 3% of the population. But as I just said, we're talking like 20 years ago. I haven't actually seen any updated research on the prevalence as of now, but I have heard sex therapists talk about it seems to be a lot more common than 3%. So here's my mission to change that, to update you on some research that I have found, as well as what I've learned. According to the Journal of Sexual Medicine, delayed ejaculation is poorly defined, and 25% of patients that struggle with this have a psychological cause to not being able to finish. As always, short disclaimer if you didn't already know, watching videos such as mine about sexual health on YouTube should not be used as a replacement for getting therapy or going to a doctor. It's always good to continue our education. Knowledge is power, and that's why I love talking about these topics in a way that is evidence-based. However, if you are struggling, definitely see a doctor, definitely talk to a sex therapist. So what is delayed ejaculation? It's commonly referred to as psychological or medical in terms of why it happens, and this means an inability to ejaculate from vaginal sex or intercourse in less than 10 minutes or nearly at all. The issue must persist for at least 6 months for it to be considered delayed ejaculation. This is not like a short-term issue. And a really important distinction here is it is delayed ejaculation if it causes distress because you're not able to finish. So if you're experiencing negative personal consequences, or you have a partner, for example, that is having self-esteem issues because you can't finish, and this is something that you've been trying for a while and you notice it's just not working, that is when it should be addressed. If it's not causing you or your partner distress, there's not a dysfunction here. One of the questions that I commonly get asked in my comment section or when I go live on TikTok is, how long should one have sex? Or how often should I masturbate? And I always make sure to remind people there is no golden rule or golden number for how long somebody should last, or how many times should I masturbate per week or per month. One point that counteracts that a little bit is that I did learn from my sexual health studies that doctors tend to recommend about 21 ejaculations per month for a healthy prostate among men. However, you really can masturbate as much as you'd like. There is no golden number. It's really a personal preference. If masturbating too much is causing you distress, let's talk about it. If you're not masturbating enough due to shame and anxiety, let's talk about it. There is no, oh yeah, 3 times a day or 3 times a week. There could be some recommendations based on personal preference, but it's not a one-size-fits-all. One of the most common causes of a delayed ejaculation issue is what is known as the death grip. A lot of men tend to grab their penis in a very tight manner. And the tight grip that they have on their penis, and sorry, I'm like imagining a penis here, imaginary penis. This is my imaginary penis. If they are grabbing onto it in such a way, this cannot be replicated by a vagina, somebody's mouth, somebody's hand. It's just not possible because of the grip. It's just not replicatable.
Firmly grasp it!
So if somebody is masturbating very often with a very tight grip, it would make sense that they're not able to have an orgasm in other scenarios involving sex, or you just get so comfortable with coming in one way. The idea of any other stimulation getting you off is just not realistic. If this is something you struggle with, the death grip, it's important to first off be mindful of it. Therapists will typically recommend that you try different styles for masturbation. One way of doing this is switching to a different hand. So if you masturbate with your right hand, you're right-handed for example, try with your left hand. That's one thing you can do. Another thing you can do is stimulate your penis in a way that's more similar to a vagina. For example, a fleshlight. Practicing with a fleshlight can be helpful because that's meant to feel like a vagina rather than your hand. Before getting more into the evidence-based treatment for delayed ejaculation, I do want to remind everybody that masturbation is healthy. There's been a lot of stigma on masturbation in history, but I do want to remind you, it is good to masturbate often. It relieves muscle tension, it boosts your immune system, helps you sleep better, releases those feel-good hormones that get you in a better mood. It can increase productivity. Individuals that masturbate often and have a happy sex life are more likely to succeed at work. And as I've mentioned many times, men who ejaculate often are less likely to be at risk for prostate cancer. So, hey, and then when I say that on TikTok, the comments are filled with, oh, I'm gonna live forever. So yeah, I've heard that one before. But yeah, if you wanna brag in the comments about your immune system, then I won't be mad at that. Masturbation, it helps relieve that build up stress, helps you understand your sexual needs, and you get that sexual release without the issue of unwanted pregnancy or STIs, so why not? Like I've said before, I've heard so much research that delayed ejaculation is rare. But Dr. Snyder is an example of a doctor who does a lot of presentations in the modules for my sex therapy training at the Sexual Health Alliance. And he talked about how in his particular practice, and he works with a lot of men, delayed ejaculation does not seem to be so rare. He talked about how the treatment is cause specific, so of course you have to figure out what's causing it. A lot of the time it is the masturbation style. And typically delayed ejaculation is not something that needs medication as a treatment. He was also recommending that men use a fleshlight for different types of stimulation, as I had already mentioned. Something else that I learned from reading an article by Dr. David Lay, who's also another Sexual Health Alliance sex therapist with a PhD. He was talking about how even though most men don't want to use a condom when they're masturbating, he actually encourages it. Because using a condom while you're masturbating can replicate the stimulation of sex, but it can also take away that potential anxiety or discomfort associated with wearing a condom during sex. Because apparently a lot of people skip over the use of condom, which we definitely don't recommend as sexperts. So I was intrigued to see a case study about delayed ejaculation that was published in the last couple of years, so I want to talk about that. Disclaimer, this was an article that I was unable to access fully because yeah, they try to get you to pay for them, but nonetheless, I was able to read the methods and some of the results. It's still worth sharing because they do actually share without buying the article that these are the methods, this is how long we did it, and there was success. So I'm gonna share it because this is a peer-reviewed study. I couldn't find anything for free that was recent, so this is the best I've got. Rodriguez et al. 2021, they used an exercise app program and a masturbation device with 3 types of sleeves / male masturbators combined with a lube with the same brand name, which I'm not gonna mention because this isn't sponsored. And now that I'm thinking about it, calling it a sleeve is a lot more classy than pocket pussy or fleshlight, which I guess it looks like a flashlight, so people call it a fleshlight. But yeah, I can see how they would use sleeve in a fancy study because sleeve. It just sounds so innocent. I like that, sleeve. A 36-year-old man with delayed ejaculation, no other comorbid diagnoses. He attempted intercourse with a 40-year-old woman about 12 times and he was unable to finish each time. The study asked him to use this device with the 3 different types of sleeves. He had to move it up and down repeatedly and increase the speed using his stronger hand at first. Then he was asked to switch to his non-dominant hand. See how I mentioned that earlier? So let's say he was masturbating with his right hand, he starts masturbating with his left hand instead. Lastly, the last exercise of the protocol, and I thought this one was very interesting and very helpful. It makes a lot of sense. The exercise was to use the sleeve to masturbate, but instead of moving his hand up and down like people are used to doing with a fleshlight, the protocol asked him to hold his hand still and move his body to the fleshlight. So pretty much he was fucking the fleshlight but not moving it up and down. So like typically when a guy is flicking the bick or choking the chicken, right? He's laying down and he's going like this. But this last protocol was more replicating actual sex because it required him to move his body and thrust, kind of like if he was in missionary position or doggy style. So that's what they had him do last. I wanted him to legitimately make love to the sleeve instead of just yanking it. So after 4 weeks of treatment, this case study guy, he was able to ejaculate in his partner 100% of the time in less than 15 minutes. So yay, success. Delayed ejaculation makes more sense when you really think about it like this. Individuals who are used to having an orgasm in one way, let's say they never had sex so they're not that sexually active, or they masturbate so often, it makes sense that they might not be able to explore the same type of pleasure or be open and present to the same type of orgasm when there's another person present and they're having to do different motions with their body. There's the psychological issue of you're not alone, so maybe it feels less safe if you feel vulnerable, or with a lot of men, there's this performance anxiety that gets in the way. But at the same time, physiologically, it's a different movement. So for example, if a woman is used to having an orgasm by laying down and using a vibrator, it might be really hard for her to actually have an orgasm with a partner that wants her to sit on their face, you know? So what is often recommended by sex therapists is vary the way that you orgasm when you're on your own, if you want to explore more pleasure types when you're with a partner. If you're a woman that struggles with that and you can only come in one way, it's recommended to maybe ride your vibrator or dildo. See if you can accomplish orgasm that way. And then in the future with a partner, you might have more variability in pleasure. Please do let me know. Have you ever struggled with delayed ejaculation? Do you happen to struggle with the opposite problem? Because on TikTok, I do have a playlist called Lasting Too Long in Bed, which is obviously related to delayed ejac. I also have a playlist on how to last longer in bed, because it is more common for premature ejaculation to be an issue. And when you look at the definition for premature ejaculation, that is when somebody finishes in about a minute or less, but they don't want to. Some people are okay with that, but some people, it causes them distress. If you want me to make a more updated video on premature ejaculation, please let me know below. Please don't forget to like and subscribe, turn on bell notifications. I will be posting every Sunday. I really hope that you learned something new. I have some resources below, including the study I was talking about. If you want to purchase that study and learn more about it, then more power to you. Thank you so much for watching, and I'll see you next week for another video. Bye.